All right. Welcome, everyone, and thank you for joining us today. My name is Amanda Demmer. I'm the Program Coordinator for the Community-Based Research Canada Network and the moderator for today's session. Our speakers today are Dr. Richard Oster and Maskwacîs Maternal. We also have Joanna with us today, who is our Acting Executive Director for CBRCanada. And my colleague Julia will be joining us to support throughout the session today as well. We do have the recording going. This event is recorded. You can also toggle your closed captions on and off if you require them through the Zoom function. Today's session is the third of a three-part series celebrating community-based research excellence by highlighting the previous winners and nominees of CBRCanada awards for community university partnerships and emerging community-based researchers. This presentation today is brought to you by Community-Based Research Canada. The CBRCanada Secretariat is situated on the traditional territory of the Neutral, Anishinaabe, and Haudenosaunee peoples. We're a membership-based organization whose mission is to advance community-based research excellence in Canada by strengthening partnerships, building capacity, mobilizing knowledge, and championing community-based research among individuals, communities, and institutions. We are a social enterprise funded entirely by our membership. And as part of our programs, we host events such as these webinars and live discussions, as well as bi-monthly community of practice events. You can find more information about our upcoming events, as well as view past webinar recordings on our website. And I'll post that link in the chat for folks shortly. As we get started today, we like to start each e-learning event by reflecting on and amplifying the goals of the Truth and Reconciliation Commission's call to action. So today, in the spirit of reconciliation, I am highlighting call to action number 5. We call upon the federal, provincial, territorial, and Aboriginal governments to develop culturally appropriate parenting programs for Aboriginal families. CBRCanada is committed to continual reflection on the interconnections between truth and reconciliation and the various topics we approach using community-based research. The agenda for today's webinar will begin with the presentation by our speakers. So this webinar portion will be recorded, both their presentation and the question and answer period. After this formal webinar, there will be a live discussion, which will not be recorded, where we'll get to discuss some discussion questions that Dr. Richard and Maskwacîs have posed for us. We'll do this in small breakout groups, and then we'll come back together for a large debrief at the end. Just some quick housekeeping. During the webinar portion of the event, please stay muted. Please feel free to enter your questions in the chat if any questions come to you throughout the presentation. When we get to the question and answer period, I'll be reading those questions from the chat to Dr. Richard and to Maskwacîs. So I'm very honored to introduce our speakers today, Dr. Richard Oster, who's the Scientific Director of the Indigenous Wellness Corps at the Alberta Health Services, as well as an Adjunct Assistant Professor in the Department of Agricultural, Food and Nutritional Sciences at University of Alberta, and an Adjunct Assistant Professor of the Department of Community Health Sciences at University of Calgary. And Maskwacîs Lightning, who's an elder and knowledge holder. And you're going to have to pronounce or correct my pronunciation here, Rick. I wonder if I can let you introduce yourself.
I come from Ermineskin tribe. There's 4 tribes that are situated originally. We're under the umbrella of, our name is Maskwacîs, Alberta. But then under Maskwacîs comes the tribe of Ermineskin, Samson, Louis Bullen, Montana.
Excellent. And Maskwacîs is also an elder in residence at the Faculty of Medicine and Dentistry at the University of Alberta. So I will now pass it over to the two of them for their presentation. Take it away.
All right, thanks so much, Amanda, and thanks so much for having us. Good morning to some of you, good afternoon to others. As was said, my name's Richard Oster, and I'm here today with my friend, my colleague, my mentor, my family, Rick Lightning. We've known each other for a long time and have been on many adventures together. This is just another one of our Rick and Rick shows, as we call them. I'm glad Rick showed up. He made me a little nervous. And while we were waiting, I was telling Amanda, a story about how Rick and I went to Hawaii, luckily enough, and his wife Inez accompanied us years ago to speak at a conference. And I was telling her how I was sitting on the plane. I'd already boarded, and I was texting Rick, like, "Where are you? We're about to leave." And I got a text back saying, "We're almost at the airport." And they waltzed on just cool as cucumbers right before they closed the doors and everything. And I was, in the meantime, having a heart attack. All of that was part of my initiation. And lately I've been the one who's been late to our meetings, and Rick's kind of been giving it back to me. But today we've reverted back to old habits. But yeah, it's a pleasure to be here. We were invited to come speak about making relationships the focus of research, which we've definitely tried to do in Maskwacîs. Before I get started, in terms of further introducing myself, my name is Richard. My spiritual ceremonial name is Wapa Stem, which means white horse in Cree. I come from European ancestry. Since birth, I've called Treaty 6 territory and the Métis Region 4 in Alberta my home here in Edmonton. I'm a single dad. I raise my kids here. Our family's been in this part of the world for 4 generations now. And I've been really lucky, really privileged over the years to partner with a number of Indigenous communities here in Alberta, including Maskwacîs for over 12 years now. I'm no expert. I consider myself a partner working together to build from the many strengths that exist within the communities I work with to ultimately improve well-being for community members. That's the positionality I work from as scientific director at AHS. We're going to tag team this. So in about 10 minutes, Rick will take over and he'll have a chance to introduce himself more in depth. Next slide, please. So we're not here for long, and we want to get straight to the point, but here's a rough plan of how the next little while will go. So I'll have a couple of slides to kind of set the stage, why we do research in a different way that's built on trusting relationships. I'm going to introduce our research group in Maskwacîs and highlight the importance of developing trust, not as a means to an end, but actually the focus of everything we're doing. And then I'll turn it over to Rick for his reflections and perspectives. We'll have lots of time for discussion and questions, and I think we're going to do a few breakout rooms with some questions we've come up with. Next slide. Okay, so why do we need to do things differently? I won't spend much time discussing the health disparities that Indigenous peoples face. Many of you will be aware of that, and we believe that that's just a story that's been told time and time again, and don't feel that it's particularly helpful to dwell in that deficit-focused space. But suffice to say, there are marked disparities in health, and in fact, many of those are widening here in Alberta. For example, life expectancy, unfortunately. So there's certainly a need from that perspective for transformational health research. But beyond that, research is often viewed as a dirty word in many Indigenous communities because the history of Indigenous health research is a bit ugly. There's a history of mistrust in certain circumstances, and in others, exploitation and even unethical research that has been conducted. There's been a lot of well-intended research that has had unintended negative consequences. So there's been many instances where Indigenous peoples and communities have been misrepresented by research, misunderstood, where their data has been taken out of context or not interpreted through their lens. So some of the patterns I've noticed in the literature has been external observation of subjects with very little or zero input from communities, and then sort of a top-down authoritarian prescription of what communities should be doing. Surprise, surprise, that doesn't work. Luckily, this is changing and has changed, but it still happens. And that paternalistic approach and framework is still present in people's minds. Another pattern I've seen is conducting research that tends to benefit the careers of researchers and science as a whole, but brings very little or no tangible benefit to the communities that are struggling with significant health and social disparities. So this is not the distant past. It still happens. We hear it referred to as helicopter research. I've heard it referred to as vampire research. So just sucking out of communities and giving nothing back. And yet another pattern I've seen and I've alluded to already is what we call deficit-focused research. So those stories of deficit have been told many times within the scientific literature, and they merely tend to show how sick Indigenous people are without proper framing. I think that perpetuates deficit-focused narratives that contribute to stigmatization, and regrettably, this is an ongoing pattern. And it can reinforce racism and discrimination. I was just reading a paper last week by an Indigenous scholar from Australia. Her name's Maggie Walter, and she calls this 5D data. So difference, disparity, disadvantage, dysfunction, and deprivation. That's the kind of deficit-focused research pattern we've seen. So all of these approaches I've discussed have generally been devoid of any vested or emotional concern for the Indigenous people and communities that are involved, and have been dictated from a reality and perspective that's completely separate from those that are being researched. So for all of those reasons, we believe that we need to be doing things differently. Next slide, please. So that brings us to community engaged research. So if that wasn't enough for convincing you why we need to do research in a different way, we also know that interventions typically fail without community input. I've seen this happen, and I've seen the opposite, where interventions can flourish when they're led by those in the community. So doing things differently allows for opportunities to reverse stereotypes, reverse racism, and that power and privilege imbalance that's ever present. It allows for opportunities to produce knowledge that's meaningful in Indigenous communities and contexts. It allows for much needed Indigenous self-determination. It allows for capacity building and giving back, and we're going to discuss that a bit more later. So doing research in a good way, what does that look like? For us, it looks like strengths-based research, responsive research that's built on relationships, where control is situated within empowered communities and partners, and where engagement and collaboration are the priority. And that allows for, we believe, considerate, culturally sensitive, relevant, and equitable research partnerships. Okay, next slide, please. So just to introduce our research partnership with the Cree Nations of Maskwacîs, we've been working together as part of a community engaged research partnership for over a decade now. Our focus has been towards improving maternal, child, and family well-being. That's the community partner's priority. And our goal has always been to attain community-led and entrusted control over the research, such that the research leads to tangible community benefits, right? That's our overall focus. It's not to benefit me, it's to benefit Maskwacîs. And since our inception of our collaboration, good relationships built on trust have underpinned everything that we do. We feel like if we don't have that foundation, then we don't have anything. What you're seeing here is our research group logo that was designed by a local artist, and kind of our layman term description of our research group that was derived from Cree speakers in the community. Next slide, please. All right, I'm showing this slide, putting it in just for fun to show you our logos of our current key research projects that fall under our research umbrella. I wish I had time to go in depth into these projects, but feel free to reach out to us if you're interested in learning more. So our cornerstone projects we have right now is an elders mentoring program where elders are supporting pregnant moms in the clinical setting. Our Deadly Dads program, which is a peer-to-peer support group for men in the community. There's a lot of on the land learning and learning from each other. It's really about growing the spirit of men in the community. And we have our iHealthy project, which is a long-term CIHR funded project where we're developing a cohort and following moms, babies, and families over time. And we've done a lot of work over the years, and I have no time to discuss that work, but again, reach out to us. Next slide, please. Okay, this is my last slide before I hand it over to Rick, our headliner for the day. And this slide, I really want to drive home a few things that I think describe how important it is to develop trust between the two of us, researcher and elder, son and dad, friends who've worked closely together for over a decade. And it's really, a philosophy that we try to take with our research group. It's not always easy, where we acknowledge that every community is unique and every project is unique. And there's a spectrum of engagement and community involvement. So this is what's worked for us, but we feel like sharing some of these principles might be helpful to others, knowing that good relationships, of course, will look different for every research project. So for us, this means reframing Western perspectives and overcoming long-standing institutional barriers and placing trust and relationships at the focus, so rather than a checkbox or a means to an end. It means walking that talk. So how do we build trust? Rick will be able to talk more eloquently about this, but a few key things for us have been ceremony. So we feel we're able to trust each other fully when we come together in ceremony. And ceremony permeates all aspects of our research. It grounds us in the intent and the commitment of what we're doing. I think our relationships flourish when we meet in that way, in a vulnerable way, in a mutually respectful way, in a compassionate and kind way, in a humble way, where our hearts and our spirits connect. And I think that transcends the Western concept of relationship, and that's where we need to be. Another key principle is humility. So, we come together not as settler and Indigenous, nor as researcher and elder, but, because those terms tend to separate us, but rather as people. We come together as people and equal partners. And from this perspective, we make space to acknowledge and explore and reconcile that we come from different backgrounds, different systems of learning, different ways of knowing, and we deliberately open up our hearts and our minds to each other's perspective. And we accept that our intrinsic ways of viewing the world are not the only way or necessarily the right way, and we try to mutually understand one another and build from multiple ways of knowing. Emotional investment. So in short, I think we're very personally and emotionally invested in each other's lives, and that's not something we're taught from a Western perspective of research to do. Our research relationships are considered lifelong as opposed to just the life of our research project that we're working on. So this concept, it's not within the guidelines of Western research and typically goes against what we're taught, but we feel it's vital that the depth of our relationship allows us to work in a meaningful way that's akin to family. That's the kind of relationship we're trying to establish. And lastly, effort and time. It's a key component because building trust takes time. It's not just given, it's earned. Right? In our experience, trust wasn't established within the first month or even within the first year of our relationship. And we work hard to maintain trust. There's lots of bumps in the road and we need to overcome them. And again, keep relationships our focus. So that takes time. We've learned to go at the pace of the community and the individuals involved. And we've learned that relationships can't be forced into a preconceived and prescribed timeline. You can't know how long that will take. So we've restructured our grant proposals and our budgets so that we put relationship development and maintenance as the priority focus rather than a one-time activity or means to an end. And that doesn't necessarily fit into a 9-to-5 box. We live our relationships outside of work. So that's it for me. That's the end of our slideshow. I'm going to pass things over to Rick now for him to share his perspectives on this. Thank you.
That's a wap Maskwacîs Maternal sector ocean. Maskwacîs Maternal. My ceremonial, I like that. And the ceremonial name is White Bear. I come from the Buffalo Child family, and I come from the Bear Hills people. Since I've been doing this journey, I worked with the United Nations for 25 years, working on the UNDRIP with our NGO. I was the CEO for that. I had the honor to be the CEO for our project and working on the international declaration. And one of the things that's key is Western thought as to, I'm a third generation residential survivor. And in one of the key things that's always been told to us is that, white is right. If you look like us, you talk like us, you will be successful. If you try to be an Indian, you'll never be successful. And that's always something that I remember as a child hearing and going through. But now, even being hit and speaking our language, being told our ancestors don't count, and that we need to follow their ancestors. And I did a podcast the other day through Ottawa, and it was really interesting. I had about 30 people on there that were from various. There was no Anishinaabe people. Actually, it was all different races were on there. 30 of them, 30 different people, which was great. So I had to retweak my presentation, and I told them that. I said, different denominations that came to save us, and they wanted to bring God to us, and they never did. We had God already. We had a creator already. We already had laws and responsibilities that were more, but they took us from age 4. Many people were institutionalized, and that echo of Sir John A. Macdonald said, "Kill the Indian and save the child." Well, that didn't work for 10,000 children that they found buried in the residential schools. And so that's something that, and I said that when you really think about it, we talk about what is Western thought. And so when you look at the statue of Jesus, he's white. You look at the statue of Mary, she's white. Joseph, the 12 apostles, they're all white. But yet the interesting part, they all come from Jerusalem where everybody's brown. So even Western thought, even Western religions have changed their ancestors to which there aren't even, and none of the Western religions are Jewish. They're all different, Roman Catholic, Anglican, and they have no relationship. They have no ancestors that they can pray to. These are people, someone else's ancestors even. Whereas in our religion, in our way of prayer, we're still very close with our ancestors. We haven't changed nothing, and everybody is still the same. The Blackfoot people, the Nakota people, the Ojibwe people, we all have the same creator. We don't say one tribe's way of prayer is better than the other. We all share the same creator. We all pray in our languages. And so that's something that's really unique, as we've kept that bond, that connection together to all the different tribes across Canada, all the way to the Haudenosaunee people. And that's so, and probably wondering where I'm going with this is that Western thought has always tried to change everything, saying you got to be like us. But yet, 2022 going on 2023, we still have racism that's out there. There are the white people, there are the brown people, there are the yellow people, the Oriental people, and the red people. They're all, but basically there's one line that separates everyone. people, they call it people of color. And that's important to understand that. And then so I guess I'm a person of color. But one thing we've done is bringing in the researchers coming to our community. We went from ritual-based thinking to ceremonial-based thinking. And I think that's really important. Can you hear me? Am I still on here?
Yeah.
Yeah.
We can still hear you. Yep.
Okay, good. And so we went from ritual-based thinking, like when our first treaties were signed out here, our people sat around in a circle and had a spiritual pipe, and they prayed for this connection, this treaty that was being signed. And the government people sat at the table and watched these Indians, and they thought, wow, look at those Indians are doing a ritual. This goes all the way back to treaty. Not realizing that spiritual pipe is that was based on spiritual. We were praying to the Creator to help us make sure this works. And at the table, they didn't even have a Bible. There was no religion based on there. It was just government people. So we came in there with a spirit and intent and goodwill towards these treaties that were signed, which all, by the way, were broken because they didn't have God at their table. They didn't have to declare in front of the Creator. They just said, we're signing. It's just a document. But to us, it was a spiritual document. So there's two different kind of thought processes that happen. And that's still today, we still think like that. And so when research came and I became involved with Rick, I said, I need you to know my family and I need to know your family. We need to have a relationship. In order to be, you can't be partners without building trust and a relationship. Today, his children can't call me Muslim. I have a relationship word to the point I love his children and they love us as well. We see that they see us as Kokum and Muslim. That's the bond that we worked on, creating that bond. But it wasn't overnight. But at the same time, understanding, the lens. My friend Adam, he's a research student. When he first came here, and today he's part of our ceremonies and everything. He's part Filipino and his mother is white. And I said, what single thing that changes you? He says, when I came here, I had a lens I was looking through. Now I see from your point of view. I see what you're talking about. I understand and I feel what you're talking about. And that's really important. Now, when this young man graduates with his degree, his PhD, he's going to be the most amazing individual because he's going to be able to have the lens from the academic point of view as well as the cultural and ceremonial point of view. He's going to be an amazing young man in our communities. And he's going to be an asset to Canada because he's going to be able to, he understands. And that's something that's so important is that we look at academics as important, but we also look at the cultural part of our people in respect of that, and that respect that comes with that. In my family, I have 2 daughters that are lawyers, and I have I have 5 daughters and 5 sons, 37 grandchildren, and 10 great grandchildren. My wife just passed through their master's in Canadian history. But yet, one thing that's key is with the academic part of it, is also the cultural part of it. They participate in the ceremonies and they understand that. They've grown with ceremonies since children. In fact, we lived in teepees in the mountains every summer, so I wanted them to understand who they were. And they grew up that way. They were very lucky to be able to have that, very gifted to have that, because that gift was passed on through my father, Albert Lightning. And so I was able to give that gift to my children. But the thing is, one thing I think that's really important is like we hear about traditional teachings, but I'm more of a traditional showings. I believe that's more important than just talking about it. We need to be able to participate in it and understand that. We brought 350 med students out to Maskwacîs, to Bear Park, to our powwow grounds, to be able to participate in a ceremony and recognize them as who they are, as leaders, the future leaders, future doctors. It was a really moving ceremony for many of them because they never experienced that before. They never been on a reserve before. 2 weeks ago, I brought 30 first and second year doctors, students to my home, and they never been in an Indian home. And they came in. My home's it's 45 years old. And we did a sweat for them. We did a sweat in the morning for half the group, and the other half went to tour our Maskwacîs Health Center, which is an amazing structure by itself. We have doctors, we have dentistry, we have all the different areas, home care, and they got to tour that facility. And then we flipped it around in the afternoon. They changed, and we also had elders come to speak to them. At my home, I invited some different people to come talk to them, to give them a perspective. And so that these grandparents that came to talk to them, and it really impacted them, because they were able to be here and on a reserve and be able to see that. I just met with the chancellor last week, a couple of days ago, actually, of the University of Alberta, and talked to her about creating maybe a satellite area for our U of A students to come out to Maskwacîs and rent a space and have a space on a reserve so they can come out here. That's an idea. The other idea I talked about is understanding our grandfathers and grandmothers. We're called elders, but there's really no spirit behind that name. Whereas I'm a grandfather, I'm a Muslim. There is a spirit in that, going again to ritual-based thinking, to ceremonial-based thinking. And I always tell them, many of your mothers, when you first became a mother, when your child said, "Mom," that initiated you to be a mom. That comes with the rules and roles and responsibilities. And when you're called dad, again, it's the same thing as a grandfather. When you're called Muslim, again, that change, that then you're initiated and you become a Muslim and Kokum. And again, the rules and roles and responsibilities are placed in there. That comes with that name. One of the things as well, in the last 12 years, we've had many grandfathers and grandmothers sitting on our various research teams, and they've passed away. It seems people don't realize that these people that have sat on our research teams have come with interesting backgrounds. It's not a pan-elder thing. Everyone has a history that they bring to the table. And that's really important to understand that. It's just not old people sitting at the table. These people actually have come with tools and knowledge from their background, from the work that they did when they were younger. And that's really important to recognize that. And that's so important that, a lot of times people don't understand these elders are just pensioners, and they live on a limited income. So it used to be, they'd give elders $50, $100 for a day. And I said, no, that's wrong. These people are at the level of PhDs in a human understanding of life. And we need to up the ante on that and pay it properly and respectfully. And that's something that we've brought that up to that level. And we're still moving towards a higher level, because these people their time is limited. Like I'm 69 years old, so I'm on a downward spiral down the mountain. And believe me, that slate goes faster and faster. But the thing is, recognizing our elders that have been here and that passed on, we still haven't forgot them. We recognize them as part of our team still, as our ancestors. And so they help us. We ask them to help us from the other side. So that's something that's important, is understand a holistic understanding of who we are and where we come from, but also our responsibilities as grandparents and grandfathers and those pipe holders, ceremonial holders. There's laws and responsibilities that come with that. And Western civilization doesn't know that. They think it's just a peace pipe, but that pipe there's a lot of responsibility that comes with that pipe, or else that ceremony, whether it's Sundance or different ceremonies we have, different people have rights to these ceremonies. And that's important to understand that. I don't have rights to a Sundance, and I'm okay with that. I'm great with that. Just don't mind me, I'm kind of moving the sun. I love the sun. And so understand the research, understanding what rights do we have to speak to various things. And the researchers as well coming here and understanding, okay, in order to have the rights to write, you have to come to our ceremonies to come to understand who we are as Nehiok or Anishinaabe or the different names that we actually have, not Western names that were given to us. Even the term reconciliation is interesting. Somehow we're part of the equation of reconciliation, but we never did nothing wrong. But it's the government that has to do reconciliation, and because, and so that's what reconciliation to me is that understanding and saying and talking, going into asking those uncomfortable questions. But is Canada ready for the uncomfortable answer? When the 10,000 babies were found in the graves across Canada, and they're still finding them, that was there before. The people knew that. But here's the interesting part. Those 10,000 babies had parents. So you multiply that by 20, that's 30,000. Then you multiply that by 4 grandparents from each side, and it comes out to about 80,000. So the number is bigger than 10,000. But we're comfortable by saying 10,000. For some reason, we're okay with that. But when the number gets higher because of the people that lost these children, and the grandparents had lost that right to be able to teach these children, is lost in the wind. And I understand that. I see that. And so that's something that's so important to understand when we look at, I know we have a brief time here, so trying to give you an understanding of who we are, where we come from. Edmonton had the largest Western residential school here, as well as we had residential school people that we went there, and there was also day scholars as well. Our number here in Maskwacîs is 18,000 people. And so what happened then was 18,000 people is that the effect of the residential school has been, we call it intergenerational trauma. But now we're at 3rd, 4th generation child welfare recipients. Child welfare people having babies and them having babies and so on goes down into generations. And that's the residential school concept of kill the Indian and save the child still going echoes through the halls of society, whether it's in residential school or else in child welfare. The number of our children that are in care is staggering. And so that's something that's important. So reconciliation to me is saying, okay, let's put some money into communities and help develop families and give them the tools to be able to deal with their trauma. I'm an alcoholic. I've been sober 38 years. And I had to deal with my trauma from residential school. I had to come to terms with who I was, my sexuality, my spiritual being, who I am as a Nehio. My wife is from Manitoulin Island. Her name's Inez, and her mother went to Spanish. So we had 2 residential children that came together, and neither of us heard the word love. We never grew up with that word. And that's one thing we talk about. How can we change this? And so we told our children we love them every day, and they so the word love is in my family. That's part of the healing. That's part of that, creating that love amongst each other and saying it out loud, which is something we never heard, either of us heard growing up, and showing emotional trust to each other, which we never seen as from. If you imagine being 4 years old in a residential school and going through that institution and never having an emotional involvement with anybody other than a negative way, that was something that was today is where families are still struggling, trying to have that, learning how to love again, how to love themselves. So the family systems we need to work on is giving them the tools to be able to learn that. And that's what we're doing here with the prenatal program. Our grandmothers are sitting at the prenatal clinic, and they're there for these young girls coming in, having babies, and they're able to, a lot of the grandparents have passed on. So we're giving them opportunity to have a locum to talk to, any questions they want to talk to. So, and it was slow at first, but now it's at the point where even the prenatal, even the clinic is looking at actually putting some money towards these people because they see the importance of them in Wetaskiwin at the prenatal clinic. This is off reserve. So that's part of that concept of saying, yes, we have what the money we get, we use towards the community, and we involve the community in decision making and everything we do. It's not from the top. Sometimes we shake the top people up a little bit because we say, no, that's not the way we're going to do it. Even the funny word is we call our young mentorship program called the Deadly Dads. And our head lady didn't like the name because she didn't understand that in our language, deadly means good. She thought it meant bad. And I had to tell her, no, it's a good thing. Leave it alone. It's our word. She said, okay. So we have the Deadly Dads out here, and it's a really cool name. Everybody understands what that means. And our group is growing. And now that we've kind of we're moving away from research into a program and looking at funding this program for our young men to be able to, and a lot of the young men we're dealing with are young men that have no jobs, no education, but they have children. A lot of them are single parents, and at the same time, we're promoting families as well, healthy families. So our Deadly Dads are both single and have families. So that's a cool program that we're developing. And we were in Vancouver at a international conference, health conference, and people called us from the Inuit. People called us, and we did a Zoom with them how to do the Deadly Dads. We're very open in sharing our information. We've done it, and a lot of the communities have talked to us about that. And so we're going to be doing that as well, is promoting the Deadly Dads, promoting healthy families and healthy men. So that's something that's coming along as well. And 4 things we've done that are amazing. We went to the mountains and we camped in teepees. One teepee because we got there late, but we were able to camp there, and these young men were able to interact with their children, which a lot of them never been to the mountains in a long time because they didn't have the transportation or the finances. So we were able to create that for them, and they really loved that. They really enjoyed that. And then we did a round dance in the spring for the Deadly Dads, and we had over 200 people come, 250, I believe, and that just after when the pandemic. And so we had the first round dance of 3.5 years in Maskwacîs, and it was a super success. And the neat part that really was great was that nobody went home had the virus. So that's another positive because of the spirituality. We prayed that to keep that way, and so our prayers were answered that way. We also, then one of the things we talk about, people going to hunt, but they couldn't hunt. They didn't have access to get their license to buy it. And so that was something we created. We called a lady in, and we got them to be licensed to be able to buy a gun to hunt and provide for their families. A lot of times we tell people you need to do this, but they don't have a solution. We create solutions. That's one of the things that's part of our Deadly Dads. We look at solutions. How can we make this better constantly? So that's something that we're doing with them. And we also have fun. We just don't do men's circles, and we have fun stuff, and then create stuff that we go bowling for. And a lot of them never went bowling before because they didn't have any money to bowl. Now they had fun with their children, and they bowled. Laughter. We promote laughter. And so we do fun things, but we also have a serious part of it where we do circles and say, is it time? Do we need to do some talking? And they'll tell us, we need to do a circle. I need to talk. I need to vent. We said, we're done. We'll have a circle and we'll talk. So in the door is a revolving door. We don't have a club. Everybody comes when you want. When you need to come, we're always there. And that's the key part, is that because of people being transient, sometimes they have an opportunity to come and sometimes they don't, but the word on the reserve here is really positive about our people. So that's kind of it in a nutshell. I know we have time frame, so I'll leave it at that. Thank you.
Thank you so much, Rick and Richard. It's been so valuable hearing from you a little bit more about this program. that you run and the research partnerships that you've built throughout this. So we have about 10 minutes for folks who might have questions. So if you do have any questions for Maskwacîs or for Dr. Richard Oster, please post them in the chat and I will read them off. To get us started, I had a question to pose for you both. As I'm hearing about the research partnerships that you have, it sounds like there's a lot of non-traditional ways you've been able to incorporate community-based research into what you do. Richard, you talked about in your grant applications, you build in the relationship building time right into those. And Maskwacîs had spoken about compensation practices for elders participating in research. I'm wondering if you've faced institutional barriers to trying to incorporate these practices within the universities you're within, and if so, how have you worked to overcome those? What successes have you had, I guess, trying to bring these practices into your institution?
I can start. We're really upfront about all of it. Like when we write proposals and we request funding, there's no secrets about what we're doing. And I think I get the sense that our group is viewed positively because of that we're kind of, blazing a trail. Mm-hmm. So we've been really lucky funding wise. Of course, we've had many failures too, but we've been successful, I think, because we're upfront about that. And of course, there's institutional barriers at AHS or the U of A because they're Western institutions built from a colonial perspective, but we just honestly, we find the loopholes. So each of our elders, for example, wishes to be paid in a different way that works for them. Mm-hmm. And we respect that and we just find a way. So, I think other people or researchers might see that as just a burden, right? Because sometimes I send money out of my own account and then get reimbursed later, things like that. But, I'm just happy to do that. I don't see it as a burden. And I think you hear that a lot with community-based research, that it's so time consuming, it's so difficult. And I really don't like that narrative. I like to change it around and think about how lucky we are and like all of the many ways this work has enriched my life that there's no way I could ever give enough back. Mm-hmm. There's no way. Rick?
I think one of the things, like, not only do you have to deal with the institutions as well, we have to deal with our chief and councils, and that sometimes can be interesting as well. But you know what, I forgot to mention, one thing we got, they took our Deadly Dads application to Urbanskin chief and council, and they're pretty stingy sometimes, but they earmarked $30,000 for us in April for our Deadly Dads towards for Urbanskin men. So that's super positive. That's amazing we got that. And the other part I want to mention real quick as well is a lot of times there's a man that went to see this grandfather and asked him for some medicine. He needed some help. And so that he was standing there and this young man said, the old man went puttering along to go get what he was asking. He had brought tobacco in a blanket and he said, okay, I want you to come with me. He took him to the back room and opened the door and there's blankets and tobacco. He says, now go look on his fridge. And he walked over there and opened the fridge and it was very sparse. And people say, why do we have to pay these old people? Why do we have to pay these cultural people? Well, because they have to eat as well. You can't eat blankets and you can't eat tobacco. And so, and they won't say anything. They'll just take it and just go with that, put it in the back room and try to go on with their lives. But people need to understand that that's the reason why we need to look after our elders and buy them and give them money to be able to continue on living a life and comfortably. Have food in the fridge. They sit all day with a lot of different institutions and then they go home with $50, $150, and it costs $100 to get there. So they have $50. In today's world, you might be able to get a loaf of bread and a bologna out here anyway. But so that's something that's important, that understanding the barriers are not only institutional, but also the barriers are for people's own thinking, is that, here's $100, this is for an all day thing. And they don't understand this individual needs to eat. If they travel there, they have to be able to pay for their vehicle and insurance and all this, the list continues. They never think about that part. They only think about the knowledge that they want and they get. They don't think about the individual, how he or she got there and how they live. I just wanted to share that as well.
Thank you. I think it's very valuable to build everyone's understanding on the importance of these practices. And Richard, I love the way that you had worked to kind of reframe community-based research as something that's difficult or burdensome, because we certainly hear that a lot from folks. And there are these barriers or things within institutions when you're doing research in a way that doesn't mesh with that Westernized institutional way of understanding research. So very valuable to hear both your perspectives. I've seen 2 more questions come in the chat. One of them is about this concept that you spoke about of emotional investment. How could this concept be shared and understood by others living in Western perspectives, especially when doing research together?
I think we need to have more opportunities to get outside of Western perspectives and Western situations. Like, I think we need to go to communities. We need to have experiences in communities. That's where I've had the greatest learning of my life. And I could list so many of those kind of transformative experiences that I was really lucky to have. But I'll just mention one, there's a dietitian in Maskwacîs that's amazing. And I remember sitting with her one day and she was just chatting and she's like, you see this diabetic handbook? I don't use it. I might as well just throw it out the window, and it doesn't work out here. She talked about, in my training, I was taught to never hug any of my clients or never share anything emotional with them, and just keep it, extremely objective and kind of sterile is how they're taught, right? She's like, no, I have nicknames for my clients. If my clients need a hug, I give them a hug. That's why she's so effective out there, is because she's personally and emotionally invested. So that's just one example, or my mind was just like, wow, that's so true, right? What we've learned doesn't work everywhere. It's not the only way or the right way. So I think we need to have experiences in communities. We have to meet together, right? You can't read about this stuff. You have to, I can't tell you all the things I've learned just from sitting in Rick's house, at his dinner table. So we need to humanize research more, I believe. I've spent years in cell culture labs and, that type of research, and it's really, really valuable too. And we have to recognize the value of this type of research too. That's very, as I said, humanized. I don't know if Rick would add anything further.
I think one of the other part is not about emotion. When we talk about emotion, being able to share your emotional truth with us, because it seems like everybody wants to hear our truth, but nobody ever wants to share their truth. It's like it's a one-way thing. I want to hear about you, and what about you? That's not important. I want to hear about you. I'm here for you, and I'm going, no. In order to, it's a two-way street, and it needs to be that way. It has to be. If you're going to be able to willing to be able to share your emotional truth, and so that's something researchers need to do, is to be able to be human and say, yeah, I'm having to be able to have that talk with us or to share with us. I'm struggling at home, my relationship or my children. We have the same problems, but the thing is, it seems like people are too shy to say that they're having problems or they're struggling, and we can help. Sometimes we can help by ceremony and stuff like that. We've worked with some researchers that finally told us their emotional truth, and we took them to ceremony, and that helped. So that's not only are we talking about emotional investment, but we're also talking about sharing our emotional truth.
So a true sense of reciprocity in there. One of the things that touched me earlier when you were speaking to was you'd said something about, for us to partner together, we need to know each other's families. And Richard, you'd gone back to that point here, that you've learned more just sitting at the dinner table. So that sense of reciprocity and sharing when you're building those relationships, to me seemed to be something you both emphasized. Well, final question that came in the chat here is a simple one, hopefully. Where can we learn more about your work?
We definitely have publications that we can share, and like we have some reports that were designed for the community too that I can share. So I'll just email those to you, Amanda, and you can share them.
Excellent. Yeah, if you send those with me, we can include the links to those on the information that we send out after this webinar.
Maybe Rick, you can also send her that paper we did on research.
You will. You bet I will.
And I think, and the answer to your question, there was a young lady. I sent a paper to the United Nations in New York on youth suicide, that we were in a crisis around the world. And there was a young lady that was sitting in the audience from the University of New York, and she called me. She said, "I want to do my PhD. I'm doing my thesis on. I want to do it on Aboriginal suicide. I'd like to interview you on the phone." I said, "No. You're intelligent. Figure out. You come and see me, and then we'll talk about it." And she said, "But I'm a student. That means you're intelligent. You'll figure out how to get here." And she did. She was from Pakistan, and she came and she stayed out here for she's supposed to be out here for a week, and she ended up being out here for 6 weeks, and she wrote her paper, and she got to be able to be. So the answer to the question is, if you want to know more about what I'm talking about, you got to come and see me. Make the effort. That's not everything can be. That's the problem with research, is that people tend to read, sit in the libraries, look at their computers, but there's no personal interaction. You don't get you get a half of what the understanding of that knowledge, but you have to make the effort to be able to, and that's what Rick and I promote, is that take the time, get on a plane, get on a train, get on a whatever, come down and come see me, and we'll have my door is open. I've had people from all over the world come to see me and stay with me so that we can share knowledge. And that's the key word. We share knowledge. It's not a one-way street. So that's something that's important. So if you really want to know people, go to their homes. Don't just read, because there's a lot of people out there that are talking about us that become Indian specialists that just read papers but never had their interaction with us, and that's wrong. It's like his grandmother in Hawaii said, we're at a world language conference, and she told all the PhDs, you guys cheated. You went around with your PhDs on language about the world, but you never once came to see us. So you got your PhDs, and you guys cheated. And remember that, Rick, when she were in Hawaii, and she said that, and they didn't know what to say. They were uncomfortable. And the problem is she told the truth. It's that people do things, research, and then they don't actually go see the people, and then all of a sudden they become professionals. So that's my answer to that question.
Excellent. Thank you. I really appreciate that emphasis that you put on that face-to-face and real world connection with folks. So thank you both. I'm going to share my screen again, just as we wrap up this final formal portion of the webinar today. Some of you may have to run before we get into the discussion in the breakout rooms, but I strongly encourage those who do, please stick around. This is the most valuable, most exciting part of these events, is when we get to do our discussions following the webinar. For those who do have to leave, or for those who are watching this recording online afterwards, please stay in touch with us. You can do this by visiting our website and subscribing to our e-news. And a big thank you to our presenters today, to everyone who has been here with us today, anyone watching this online, anyone who's asked a question, thank you for being with us. I will stop the recording now, and we'll continue on with the informal live discussion.